If you are pregnant and experiencing any of those symptoms, please don't ignore them. If it's your first time here, this is Motherhood Journey with Abiola. If you like this video and you want more content like this, ranging from pregnancy to postpartum lifestyle and motherhood in general, drop a comment on this video and ensure you subscribe to this channel. Let's build a team of mothers and even fathers that make a difference. Pregnancy is a beautiful and exciting journey. It's a time where your body is growing your little one, just for you to meet them in a short while. Although pregnancy comes with a lot of signs, nausea, tiredness, and sometimes mild headache. But there are some symptoms that are red flags in pregnancy, and when you feel them, you must not ignore them. Let's get right into it. Firstly, if you are experiencing heavy bleeding in pregnancy, do not wait at all. Ensure you get to the clinic immediately. Even though in the early stage of pregnancy, spotting can be seen, but the moment you start seeing bleeding that feels like your monthly period or a bleeding that doesn't stop, then it's time for you to get checked by your healthcare provider. Sometimes heavy bleeding can be a sign of miscarriage. It could be a sign of ectopic pregnancy or something more. Don't sit at home to monitor it. Pregnancy is not a time where you will say, okay, let me monitor these symptoms till tomorrow. Immediately you notice heavy bleeding, run to your healthcare provider without taking any chances. Additionally, severe abdominal pain should not be overlooked. Although during pregnancy, you might feel some stretchy pains, but at a very mild level. The moment you start feeling abdominal pain, that you start bending over and it's getting intense, do not take any chances. It could be a sign of preterm labor, a sign of ectopic pregnancy, placenta abruption, or even infection. So the moment you start feeling intense abdominal pain, do not take chances. Additionally, severe headache that won't go away should never be overlooked by you, especially when it comes with a blurry vision. It could mean a lot of things that is not safe for you and even your baby. Also, it may be a sign of preeclampsia, that is high blood pressure during pregnancy, which if not managed properly could lead to eclampsia, which is something you would never want to experience as a pregnant woman. Another thing you should never overlook is your baby's movements. As a pregnant woman, it's important to take note of your baby's movements. The moment you notice your baby is moving less frequently or your baby's activity is getting too high, then you need to get checked by your healthcare provider. Although sometimes during pregnancy, your baby may be sleeping and movements will not be as frequent as before. That is why it is important to know what is normal the moment you start feeling your baby's movement, so that when you notice any changes in your baby's movement, whether too slow or too fast, you get to your healthcare provider without taking any chances. Furthermore, when you start leaking fluid during pregnancy, now let's get something straight. During pregnancy, it's normal to have a bit of fluid running down there. But the moment it is getting too much, the moment you are feeling like you are peeing on your body, you are feeling so much fluid on your body, then it's important to get checked by your healthcare provider. Pregnancy and high fever is not a good combination, and it could mean a whole lot of things. So as a pregnant woman, if you are beginning to feel high fever, you are running temperature, do not think it is just one of the symptoms of pregnancy. Get to your healthcare provider and ensure you get checked. During pregnancy, vomiting could happen at some point. The moment you can't seem to take anything down, if you drink water, you vomit, you eat, you vomit, and nothing stays in your stomach, then it's important to get checked by your healthcare provider to be sure you are not having a condition known as hyperemesis gravidarum or even something related. Furthermore, if you notice a swelling that looks extreme or sudden, get checked by your healthcare provider. Swollen face, swollen feet, swollen hands, that is a bit outrageous than the normal, then it's important to get checked by your healthcare provider. Remember, as a pregnant woman, taking chances is a no-no. It's better for you to raise alarm and your healthcare provider tells you that there is nothing wrong with you than for you to play games with yourself and your baby. Another thing you should take note of is painful and frequent contraction. As a pregnant woman, if you are beginning to have a regular and intense contraction before 32nd days, it could mean a lot of things. It could mean preterm labor or something your doctor needs to check. And if you feel it starting from your 37 weeks upward, it could mean that labor is starting. So when you start feeling contractions, it's important to reach out to your healthcare provider as soon as possible. Sometimes as a pregnant woman, you just feel something is wrong, but you can't place it. Now, this may sound really simple, but as simple as it sounds, the moment you are feeling like something is wrong that you can't place as a pregnant woman, reach out to your healthcare provider immediately. Lastly, before I go today, pregnancy is not the season to form strong woman. The moment your body is speaking, listen, do not hesitate, do not waste time. Get to your healthcare provider immediately. And that is all I have for you today. See you in my next video. Bye.